my goal has been to develop a program to identify early nutritional issues, nutritional problem, and try to treat this problem before they become irreversible. And particularly in elderly patients, we know that at least 60% of elderly cancer patients are malnourished. And the real possibility of helping those patients to, first of all, receive cancer treatments, but also enjoy a good quality of life, a good opportunity to remain in their homes, is really to address nutritional problem. The first step is really to screen these patients for those nutritional problems. And we have many tools available, but I would say that the ABRIDGE patient-generated subjective global assessment, a tool that has been developed initially in Canada and further refined in the States, is nowadays probably the tool of choice as a screening tool for malnutrition, as well as a possible diagnostic tool for malnutrition, and potentially a way to monitor patients over time while we are receiving treatments, whether are treatments related to their disease or treatments related to their problem with nutrition. Is aside from or in addition to screening tools, we need also a specific program to address the problem of malnutrition. And we have developed a cancer rehabilitation program at McGill University Health Center, which essentially includes 4 streams: a pre-habilitation program or stream, which treat patients prior to receiving cancer treatments, and a supportive stream which treat patients during cancer treatment. Then we have a cachexia clinic or cachexia stream, which look at patients who, with advanced disease, have developed important problem with weight loss and lack of appetite. And finally, we have a restorative stream for cancer patients who have completed their cancer treatment, and we are essentially trying to return to their normal life. So the problem of nutrition is common across all those streams, but also the approach common is an interdisciplinary approach. That means that we cannot just target nutrition. We have also to address functional issue of these patients, and most of the time also provide support to this patient, like psychological support or more other type of support, which could be, for instance, from occupational therapy support, and ways, in other words, to maximize their performance. Particularly in the elderly, it's important to address also problem with cognition, problem with social isolation, and which allows the intervention specific for nutrition and exercise to be really feasible, but also to be practical. And therefore we are working also with psychosocial oncology and with social worker in order to help elderly patients to benefit the most from, again, from specific nutritional or exercise intervention. And so, in summary, malnutrition is very common in elderly cancer patients. It's important to identify it early through screening tools, of which we have identified with the ABRIDGE patient-generated subjective global assessment, the tool of choice. And in order to address the malnutrition in terms of intervention, we need to have an interdisciplinary approach with that could or should start as soon as possible, even before the treatment, oncological treatment starts. I think that there is still a lot to learn, primarily to identify again the mechanism by which malnutrition takes place in elderly cancer patients. And one of these, again, is the problem of cachexia, which is essentially a malnutrition syndrome that cannot be reversed simply by feeding the patient, but is a syndrome which is characterized by metabolic abnormalities, and that is particularly important because of loss of muscle. And we know how that is important for elderly cancer patients to maintain their autonomy. So this, I think, would be one area, along with not just the problem related to the tumor, but along with the side effects of the cancer treatments, particularly the targeted treatments, who, although allow patients to survive longer, but they also have important nutritional impact. Therefore, in the future, prevention and care of the survivors will become more and more important in terms of winning the battle with cancer and its consequences.